months now, we've been talking with Kimberly Steger and Carrie Everts from Nutritional Healing about the incredible things they're doing to change lives.
And now Nutritional Healing is taking on that role in our community as the next level of health care. Here to talk about that with them is Chris Hansen. Good morning to you all.
Good morning.
Well, Kim, let's start with you. Why did you start Nutritional Healing?
So I started Nutritional Healing just under 7 years ago. My goal was to complement the healthcare system. I wanted to help people get to the root cause of why they weren't feeling well in the first place, why they can't lose the weight. So we designed a program that's personalized. You do blood work, you work one-on-one, ongoing with a nutrition counselor and build that relationship, because we have people coming in saying, I don't feel like myself anymore. I'm in pain. I can't lose weight. I have all these digestive issues, and I'm just so tired. And it's our job to get to the bottom of why.
Sure. Carrie, let's talk a little bit about some of the conditions that you can help people tackle.
Yeah, you know, the cool thing, or I guess the problem with our current healthcare system is that it's really good for acute conditions. If you have something that, you know, you show up to the ER, you don't want someone talking about what you ate for the last 5 years, you want to get better, you want a medication or a surgery or something to get you better. But that's not what most people are dealing with today. We're dealing with chronic conditions that you're dealing with every single day, and you go see your doctor maybe once a year or once you're already sick, and that's just not enough. That's not enough to heal. So we work with people with things like autoimmune disorders, digestive concerns, fibromyalgia, anything like that that's pain, it's chronic, it's digestive, it's everything in your health that your doctor can't solve once a year.
Sure.
All right, Chris, tell us a little bit about your story and how these ladies helped you uncover what was happening.
Sure. I've had digestive issues my whole life, so as I was postmenopausal, and you know, you get a little bit of this in the middle area and it just continues, you know, and I'm not that big woman anyway, but I'm like, what is going on? So I decided to go in. I really promoted it as well as an employer for my employees for wellness, to help them, because I had watched someone struggle in my business, in my office, with weight loss and so forth. So I thought, well, I'll lead the way, I'll go in, and I did, and I learned a lot of really good information about thinking I'm eating healthy, I'm eating carrots and cucumbers and tomatoes. We'll find out, actually, after a blood test, they're on my bad list.
Oh,
and if for my system and my body, I can't digest them well, so I would have issues. Thinking I'm eating healthy, but for me and my own body, not really.
Huh. You look very well. How do you feel now?
I feel a lot better. Plus, I do walk a dog.
Maybe you just look like you have a lot of energy. And you know, when people look healthy,
I know what to eat, and I know what makes me feel good. And when I found out what I couldn't eat well and digest well, I would eat those things thinking, well, it's been 6 months, I'll try it out. And within minutes, I'd be, oh, wow. It's connecting the dots. When you don't know what you can and can't eat, really, you eat everything thinking I'm fine. But when you begin to connect the dots and really I have a good understanding, you go, that's why I didn't feel good. That's why I went to bed not feeling good. That's why I woke up not feeling good. So it's really the next level of healthcare. And with my background, I'm not only an insurance agent, selling health insurance, but I came from a healthcare background working for physicians directly. And the whole system that we have in this country is really a sick pay system that Carrie alluded to versus an outcome system. Interestingly enough, the Center for Medicaid and Medicare in the next few years is going to change the reimbursement for Medicare in terms of it's going to focus on outcomes and how a patient has an outcome versus every test that you do will reimburse because it's a sick pay system. So there is a, you know, a subtle change coming, but it's, you know, a ways down the road.
And I want to briefly touch on the fact that it's not carrots for everyone, Kim. It's an
It's individual.
Yes, it's very personal, like Chris mentioned. There's no case too unique for us. We can help it all. And if you don't have your health, you don't have anything. You know, so we really want to help you with that.
All right, hey, we mentioned it. There is a special deal this morning. Nutritional Healing, of course, offers a free consultation, but now the first 50 callers will get $100 off their services.
Easy number to remember, 920-HEALING. Thank you all for being here.
Thanks for having us.